myself for 5 minutes of questions. Thank you, Director, for coming to testify, and thank you for meeting with me in my office the other day. In addition to this committee, I also serve on the Select Subcommittee on the Coronavirus Pandemic. The CDC is obviously important to the health and safety of Americans. And unfortunately, I think all of us know that the confusing and inconsistent recommendations coming from the CDC during the COVID pandemic have really damaged Americans' trust in the CDC, and we want to rebuild that. Vaccine and mask mandates implemented by the Biden administration and states have caused long-lasting distrust in the trust us, the government knows best what's for you mentality. I have been told that while you served as the Secretary of the North Carolina Department of Health and Human Services, you were a staunch proponent of vaccine mandates, extending school closures, and business lockdowns and closures. Is what I have been told accurate? And if so, how do we know you won't support government mandates at the federal level?
Well, thank you, Representative Lesko. And I appreciate that we're looking forward. We want to turn that new chapter. I think there are a lot of lessons learned from the pandemic. We've been talking about them today. And you have to remember, at different moments in time, we needed different solutions. And the good news is we are in a different place, and we can look forward as we go to make sure that we are building the national security asset that we need. And so we want to use tools that protect folks' health. Vaccines are a very important tool to protect folks' health. It's why I've been traveling around the country sharing that. But I am trying to take those lessons learned, apply them, and move us forward.
Well, hopefully you'll take those lessons if another pandemic breaks out while you're still the director. Because I oppose government mandates. I myself took the vaccinations, but I don't think it should be forced on people. And with that in mind, do you think that the government mandating vaccine mandates, it actually did the opposite effect and made people more hesitant to take them?
Well, I think vaccines are a critical tool to keeping folks healthy and safe. And it's not just the COVID vaccine, it's flu, it's all of the vaccines that have kept children and people safe for many, many decades. I think they continue to be really important tools. And I look forward to working with Congress to make sure that we can get good information to folks so that they can make the choices for themselves to use tools to protect themselves.
Well, I can tell you from personal experience talking to many constituents, the mandates actually had the opposite effect on people. Less people want to take vaccines. I think it's a better approach to encourage people to take vaccines, not to force it on them from the government, because then people just will distrust it. Not all people, but a lot of people. My other question is, do you believe that wearing cloth masks or the surgical mask, I'm not talking about the N95 mask, the surgical mask prevented people from getting COVID?
Well, thanks for that question. We know that masks work. They do work. The surgical masks work to make sure that you're protecting you, the individual, from circulating viruses. So they do work. And again, at different points in time, they were some of our only tools that we had before we had reliable tests or treatment or vaccines. But they are still a tool that we can use. But don't forget washing hands, ventilation. We learned a lot during the pandemic. We need to use all those tools.
So you believe that some of those cloth masks that people had, where the openings and the cloth is bigger than the molecules of the COVID vaccine, actually prevented people from getting COVID?
Well, so surgical masks are certainly better, and N95s go, even better than that. But cloth masks still provided some barrier to folks, but that's not, when CDC makes its recommendations about what kind of mask to wear, we say wear a well-fitting, appropriate mask, yes.
I hope that the government balances the benefits versus, for instance, in school children, having all school children mandated to wear masks when perhaps those masks benefit did not outweigh the negatives of children not being able to see lips moving or expressions and that type of thing. Thank you.
Thank you.
Go ahead.
Oh, I was going to say that is where we relied on the American Academy of Pediatrics related to safety of masks for kids, and they continue to say that that continues to be a tool that we can use to make sure folks are protecting themselves.
Thank you. And now I